My name is Jenna Deo, and the population health community I will be analyzing is Filipino women in the Philippines. The Philippines is the only country in Asia to have closed the gender gap on both education and health. It is also one of only 6 in the world to do so. Filipino women have parity to men in senior management roles, which is another reason why they have undergone 2 women presidents in the past. Men are traditionally believed to be the main breadwinners, while women are responsible for childbearing. The women are strongly tied to their traditional role as being a mother, wife, and housekeeper. Abortion is also legally prohibited in the Philippines, as well as divorce. These women suffer from domestic violence, economic disadvantages, discrimination at the workplace, and as prostituted women, which is why this community should be highly focused on. The community has several health issues. The females have a high percentage of 43% for being treated in mental health, 28% of them being under the age of 18. There is an estimated of 1,000 female deaths per year due to complications of unsafe abortions. Obesity is also an increasing prevalence, as it has jumped from 34% in 2005 to 44% in 2015 and is expected to keep increasing. Pneumonia is another factor that causes death in these women as well as their children. It is one of the top main mortality rates in the Philippines. 31.4% of these females also suffer from breast cancer. The Philippines has the highest prevalence among 197 countries from February 2017. These are the determinants from the health issues. Various primary healthcare doctors and nurses fail to receive official in-service training on mental health on a yearly basis, though officially approved manuals on the management and treatment of mental disorders are also unavailable in most primary healthcare clinics. The government ironically restricts abortion but allows medical treatment for post-abortion. However, it is revealed that it has the poorest quality. Their lifestyle-related behaviors include tobacco use, physical inactivity, harmful use of alcohol, and unhealthy diets. There is a vaccine for pneumonia, but it is normally priced too high or unavailable in most health centers. The Philippines' healthcare infrastructure is not fully developed. There are not many effective prevention programs nor treatment opportunities. The main health issue I believe is particularly prevalent is abortion. Abortion results when pregnant women decide they are unable to care for a child and want to get rid of it before birth. It develops through sexual assault and abuse from husbands, co-workers, and various others. It is mainly located in the poorest households where girls are conditioned from infancy to accept the violent behavior of their fathers, particularly when they return home intoxicated. Women are also frequently sold or bought even at a young age for a source of income. These women normally become impregnated and resort to seeking abortion remedies that are unsafe and can lead to death. They also tend to keep it to themselves as they do not want their partners to know about it or be imprisoned for seeking an abortion. This community is particularly affected because divorce is not allowed, and these women are trapped into abusive relationships. They are also too reliant on their husbands who make the living in the household, and most of these females who are too young are unable to retaliate. The Philippines is slowly getting healthier, especially from how it was before 2020. The rates of the top 20 causes of mortality in 2020 has decreased a significant percentage compared to 2019. In December 2020, a bill was passed that raised the age of consent from 12 to 16 to protect children who are constantly increasing in cases of STDs, pregnancy, and abortion. There are also predictions that the more evenly distributed the health human resource facilities are around the country, the better the people in rural areas have access to health services. The public health facilities are constantly being updated so that those in lower income families or rural areas have a balanced quality of care without having to spend more than they have or travel to private health facilities for ensured quality care. Here are a few strategies that could be useful. The Philippines and other places as well can resort to do a vasectomy on males after their first offense of sexual assault, mainly rape, or reissue death penalty of rape immediately or after their second offense. The government can also provide high standard post-abortion treatments if they are going to continue with legalizing abortion, as well as provide various contraceptives that are very effective for a reasonable price. Their education systems could highly emphasize how unhealthy lifestyle-related behaviors can affect your health. The vaccinations or medical treatment pricing should be regulated based on cases to reduce death and illnesses. For example, the higher the cases, the lower the pricing. The Philippines' healthcare infrastructure could also be continuously improved and include effective prevention programs as well as more treatment opportunities. And these are my references. But to conclude this presentation, this community is certainly worth focusing on as these women are currently still fighting for their protection and health. The Philippines is doing their part in updating their healthcare, but I do hope that it is fast and efficient enough to save this community from further complications and deaths.